For MedPage Today, I'm Nancy Walsh in Brighton, England, at the annual meeting of the British Society for Rheumatology. A major theme of this meeting has been the importance of early treatment for rheumatoid arthritis, including the use of biologic drugs to prevent joint damage and disability. I spoke with Dr. Suzanne Verstappen of the University of Manchester about her study in which she looked at baseline factors that predicted the need for biologic therapy.
If we would identify earlier on in the disease if patients need a biological therapy, we would kind of fast track these patients to biological therapy and then hopefully even limit the functional disability in an earlier phase of the disease.
In particular, she found that patients who were positive for a serologic marker known as ACPA, or anti-citrullinated protein antibodies, were more likely to eventually have biologic treatment.
We mainly found that in patients with an ACPA positive status at baseline, they were more likely to need biological therapy later on. And also we found that younger patients were more likely to receive biological therapies, and those who failed the first non-biological DMARD within the first 6 months after starting, because of inefficacy, were more likely to receive biological therapy later on.
Do you have an explanation for why the ACPA is an important factor?
In general, in other studies, ACPA positivity has been shown to be a strong predictor for worse disease outcome. So it's not surprising that this is also related to the need for biological therapy, kind of a surrogate for worse disease outcome.
What would you say the clinical implications of your study are?
So ideally, if now a patient comes in and with an ACPA positive status and he feels or she feels the first DMARD within the first couple of 6 months, we would then say, okay, maybe you should add the second DMARD, include methotrexate, and so hopefully kind of fast track these patients to biological therapy earlier on than some of the patients may get a biological therapy now.
Patients who didn't do well on conventional disease-modifying drugs, or DMARDs, also were at risk.
For MedPage Today in Brighton, England, I'm Nancy Walsh.